Baker, the governor is now out with his three-stage plan to get things back to normal. But before any of that can happen, he is watching the number of people hospitalized with coronavirus very closely. That's the number that will decide when the recovery can begin.
This comes as more cases of the virus are reported in our state, nearly 17,000. But as more people get tested, that number will keep rising.
We have extensive live team coverage for you tonight, and we begin with WJZ investigator Mike Hogan breaking down the governor's plan.
Nicole and Vic, the governor says things won't fully return to normal until we get a vaccine, but he's hoping to start reopening or allowing some businesses to start reopening. He says he's particularly looking at the number of people in ICU beds, and he's added a number of business people to his recovery team. They include the heads of Under Armour and Marriott International.
So we're now, instead of dialing things back, we're hoping to dial things back up.
Governor Hogan detailed his roadmap to recovery for Maryland, but he says the state is not yet ready to reopen.
We've had a couple of days of things that look better, but a couple of days, 3 days, does not make a trend, right? We need like 14 days. So that was hopeful, saying early May. I'm still hoping we can do that. I'm going to press to do that.
Governor Hogan says reopening must include increased testing. Baltimore County will open 2 new testing centers. They include a walk-in clinic at the Liberty Family Resource Center and a state emissions inspection center in Owings Mills.
Unfortunately, we're nowhere near where we need to be. We have increased our ability here in the county and across the state at testing, but we're going to need to see a much larger scale before we have a real sense of the number of people who are COVID positive.
Maryland reports 16,616 cases, 879 new infections in the past 24 hours, 723 deaths, that's 43 more, and the number of people hospitalized has gone up by 141. The governor says the state must see 14 days of decreasing numbers to start a gradual reopening process.
But all of it is subject to the numbers and watching the numbers, so it's a moving target.
Recovery will happen in stages. The first allows some low-risk businesses to reopen. The second, restaurants can reopen with social distancing and some non-essential workers can return. And the third allows the full opening of bars and restaurants and family visits at nursing homes.
One little day of deviation, I'm not going to say, oh, we're restarting a clock. It's what does the trend look like over a period of time?
Now, Baltimore County's executive tells us they don't have enough swabs and reagents to begin using those 500,000 test kits that came in from South Korea. In Carroll County today, officials reported 3 more deaths at nursing homes and long-term care facilities, bringing that county's total to 43. Reporting live in Baltimore, Mike Helgren, WJZ.